Friends, Dr. Nancy Trimbley here, putting the power and knowledge of your health back in your hands. We're looking at x-rays today. This is compression fracture day. And a few times a year, I have usually one of my regular patients that comes in with a sudden pain in their mid-back or lower back, and the muscles on either side of the spine are just gripping. It's called muscle guarding. Most commonly, it is right after a fall. And typically it's women that are over the age of 50. Now, that's not a hard and fast rule, but that is typical. I'm going to show you one of these pictures here. I'm going to share screen and show you this. This is a picture of one of my patients, and this is the mid back. So this is the thoracic spine. All this white stuff you see, that is the lung fields. And what I did here, because I could see that there was a vertebrae that was not as tall as it should be. The vertebrae stack on top of one another like boxes. And I measured the vertebrae. So the one that's good is 26 millimeters. The one that got compressed is 19 millimeters. This is not a horribly bad compression, but it did cause a lot of pain for this patient. And it was like a consistent pain that would not let up. I'm going to show you this image. This one's real small. I don't know if I can make it bigger, but this one shows a more dramatic compression. And usually if I have a patient that comes in with something like this on an x-ray, it is old, meaning it's from a former injury, a former compression, because once the vertebrae gets compressed, it can't get plumped up again. It's hard bone that once it loses its structure, it does not bounce back. One of the surgeries they can do if they can catch it quickly is to inject kind of cement into the vertebrae. And this is a stock image that shows the compression. And what they would do is they would put pretty much a needle inside the bone and pump up that bone with cement. And that can be helpful. It can decrease pain. I don't see this done often, but it is something that an orthopedic spinal surgeon can do. So this is what happens if somebody comes into my office like this specific patient, and they did have this compression, which just happens. I did refer them out for a CAT scan of the spine. His doctor chose to do an MRI instead, which is great. That's fine. It just shows us if there's a reason underlying as to why the vertebrae collapsed. So in my treatment as a chiropractor, what I would do is, in order to get this person feeling better, is to do massage on the muscles. We can adjust the compressed vertebrae. It's not in any danger. It's not going to compress any further, especially with the very gentle decompression adjustments I do, which just put a little bit of traction or a little bit of stretch on the joints of the spine. That can be very, very helpful. And also what we'll use is we will use our cold laser to reduce the pain and inflammation right around that area in the spine. Sometimes we even give that patient the laser as to take it home for a week so they can use it every day. And it may take a few weeks for us to get this under control, but I've seen a lot of success over my years in practice with helping people with this acute compression fracture. Now, people can also come into the office that have had this compression fracture for years and it's been painful for years. Those people do well also, and it's pretty much the same type of treatment. We do the distraction adjustment, we do massage therapy on the muscles that may be still guarding, and we do the cold laser therapy to reduce the pain and inflammation. So although these things will not correct and will not go back to brand new, we can definitely get the symptoms and the discomfort under control. So I hope that helps. I hope you liked our X-ray review for the day. Be well. Bye for now.